The church family and guests, we welcome you to this COVID-19 Facts Over Fiction virtual town hall. We welcome you tonight. Hosea 4:6 says, "For my people perish for a lack of knowledge." And we want people to have knowledge about what is going on. Thank God for our guests tonight. They will be introduced shortly. But as senior pastor of St. James, we welcome you. Want to also thank God for our family life ministry that helped spearhead this, and also Sister Hurdle and all of our guests tonight. Want you to call your family, email. We need information. Too many of our people are operating out of ignorance. And again, the Bible says, Hosea 4:6, "My people perish for a lack of knowledge." And whatever decision you make, you should make it with information from an informed position. So with that being said, let's go to the Lord in prayer. Eternal God, our Father, how we thank you for your love for us. How we thank you holistically for our health department, our doctors, our nurses, our health care providers, all those on the front lines, Lord. And we pray tonight that this information will go forth to help your people in making a wise and informed decision. How we thank you for this time, how we pray for our nation. Our nation needs prayer, and with all that's going on, from the COVID virus to the racial continued unrest, we still look to you for the answer. So we thank you now. We pray for our president, pray for all elected officials, and bless this time tonight that you and you alone receive the praise and the glory. For we ask it in the strong name of Jesus the Christ, we pray, amen.
Greetings to all. I am Deborah Duncan Hurdle, Health and Wellness Ministry Manager here at St. James Missionary Baptist Church. I am honored to share this platform as a co-moderator at this town hall meeting with Brother T.J. Lewis, member of the Family Life Conference Ministry and the brainchild of this evening's educational program. Now I take pride in introducing two fellow employees of the City of Austin, Stephanie Hayden Howard, Director, Austin Public Health, and Dr. Jason Pickett, Deputy Medical Director, EMS Systems, City of Austin and Travis County. Stephanie Y. Hayden Howard is a licensed master's level social worker employed by the City of Austin as a director of the Austin Public Health Department. She has been employed by the City of Austin for 20 years. Prior to director's position, she was the Deputy Director of Health Equity and Community Engagement. Stephanie has spent her career as a public servant, working in the field of social services and 26 in management. Her career has taken her to several organizations, such as the Austin Independent School District, the state of Texas, and Travis County. While working for the City of Austin, Stephanie has held other positions, including Assistant Director, Manager, and Supervisor. Before working for the city, she was employed by the Austin Independent School District as the Alternative Learning Center, as the Director of Clinical Services, and at the Williamson County Mental Health Center as the Assistant Director. She worked 11 years as a counselor for Travis County Counseling and Education Department. Stephanie has a Bachelor of Arts in Social Work from Prairie View A&M University and a Master's in Social Work from the Warden School of Social Services, Our Lady of the Lake University. She is trained in results-based accountability for training of trainers and coaches. She is the proud mother of her son, Cameron, who is a recent graduate of the University of North Texas in Denton. Dr. Pickett serves as the EMS System Director Medical. Dr. Pickett serves as the EMS Systems Deputy Medical Director for the City of Austin and Travis County, Texas, and is an assistant professor in the Department of Surgery and Perioperative Care at Dell Medical School at the University of Texas. Since just before the pandemic, he has taken on the additional role as alternate public health authority for Austin Public Health. Dr. Pickett is board certified in emergency medicine and subspecialty board certified in emergency medical services. Prior to his position in Austin, Dr. Pickett served as the director of the Center for Pre-Hospital and Operational Medicine at Wright State University. He is currently a lieutenant colonel in the West Virginia Army National Guard as battalion surgeon. He lives in the Austin area with his wife and 2 obstreperous little girls. I give you Director Stephanie Hayden Howard, and Dr. Jason Pickett.
Good evening. Thank you all for the opportunity to be here. One of the things that we all know, especially in the African American community, is the church is the place we go when we want information from a trusted source. Most of us will always want to know how our pastor feels, what he feels may be a good decision for us. So it always makes us very excited when a pastor is willing to open up his church and offer the opportunity for health professionals to come in to provide information. At Austin Public Health, we always make sure in our programs we lead from an equity perspective. We always want to make sure that we meet people where they are. And when we have the opportunity to be in a non-traditional place to provide services, that is a great place for us to do that. Because a lot of times, at the heart of the matter, we are government employees. And sometimes we're not seen as a place where people trust us. We have to build those relationships in our community. And so from an equity perspective, those are the things that we must do. So when we think about COVID-19 and we think about administration of the vaccines, the data shows us we have set up a registration process. In that system, it shows us that only 4% of people in Austin and Travis County and surrounding areas have received the vaccine. We know that we have far more African Americans that are eligible to receive the vaccine. And so we want to make sure by coming here this evening that we can provide as much information as we can, that we can be as transparent as we can be. I know sometimes when having conversations with folks, they really think about the safety and the security of the vaccine itself. I can assure you that as being a provider of multiple vaccines, Austin Public Health takes pride in making sure that our vaccines are monitored. We have a security system, and we also have a backup generator at our locations where our vaccines are. And so we want to make sure that we keep those vaccines very safe. In addition to that, we have staff that are able to answer any questions that people may have about vaccines. We can talk to you about the effectiveness of the vaccines and share any kind of information that you would want to know about a vaccine that you may be receiving from us. And so this evening, we definitely want to share that information. Currently, with our registration system, the individuals that are eligible to receive the vaccine fit into what the state of Texas is calling Category 1A and 1B. 1A category starts with your health providers, folks that are working in a healthcare setting, EMS, long-term care folks, as well as the folks that work in all of those settings. So it's not just your nurses, your doctors, it's your social workers. It is your custodians, it's your folks that are working in the kitchen and all of those areas. For the state of Texas, 1B criteria is anyone that is 65 years of age and older, or that is age 16 years of age and have an underlying health condition. And so that really opens up for a lot of people to be eligible to receive the vaccine. And so as we continue this evening to provide you information, my hope is that if we have people that are hesitant about receiving the vaccine, that they would change their mind and be willing to receive the vaccine from us. We have provided 85,000 vaccines thus far. We have 3 locations that we are providing those vaccines to the community. And we really try to make the process to be a smooth, quick process. With that, I will turn back over to the moderators. Thank you.
Well, ladies and gentlemen, thank you so much for having us here tonight. And I am here to talk a bit about these vaccines because we've gotten so many questions about the vaccine, about this technology, about how they work, and whether or not they're safe. And so I'm here to answer those questions. I want to talk a little bit first about where we are with our community. This week, of course, the governor, he has rescinded the masking mandate statewide, but with the caveat that you should know what is going on in your local community. What I can say is that right now in the Austin area, in our community, we are not ready to take our masks off just yet. We are still admitting dozens of people to the hospital every day who have this virus. We still have a field hospital in our convention center that is taking care of patients to help the hospitals take care of even more patients that are coming in. So we are not ready. With what we are seeing locally, we still need to be wearing our masks. But there are some additional areas of concern that I have. Folks have asked me, what about herd immunity? What if we just get the virus and then we'll all be immune and it will stop spreading? Well, a couple things I can say to that. One, if we all get the virus, that is going to come with an absolutely horrific toll of death. And just an unimaginable amount of grief that will come with that. We have not seen that herd immunity work with many other deadly diseases in our history, with polio or measles or smallpox. These viruses, which were very common, they didn't go away with people catching them. They didn't go away until we started vaccinating people widely. And I believe that COVID is the same. And I have to look no further than Brazil to know this. The region of Manaus, Brazil, which is the largest city in the Amazon, they did tests at their blood bank and estimated that 75% of the city had been infected at one time with COVID. So you think that that would make them safe, but it didn't. And because of the new variant, the new P1 variant, now Manaus is seeing a larger surge in cases than they have ever seen. So I think even we have shown that having been infected with the virus does not provide you very much protection, especially when we look at these mutations and these new strains of the virus that are coming out. Now, fortunately, we do have vaccines, and we've given, as Director Hayden Howard said, a lot of them, but we have many more to give. And we estimate that in our area, there are about 500,000 people who fall into the 1A or 1B categories. These are folks who are in healthcare or who have diseases that put them at higher risk for serious complications. Things like pulmonary disease and diabetes and hypertension. And we have a long way to go to vaccinate folks. But we have now 3 good vaccines which have authorization from the FDA to be used. The first one that we saw was the Pfizer, and then that was followed by the Moderna, and now this Janssen and Johnson & Johnson vaccine. Now, these vaccines, but the Pfizer and the Moderna, are based on a technology that we have not seen in many of our other vaccines before. They're what we call mRNA vaccines. And the way that these work is that the vaccine has a little piece of instructions, a little piece of genetic information, some RNA. And when that's injected, that tells your cells to make something. So it's like the blueprints being handed to the foreman, says, make this. And so your cells look at that and they say, okay, I'm gonna make this thing. And the thing that your cells are making is what's called the spike protein. This is a piece that is on the surface of the virus that helps the virus get into your cells, that helps the virus attack your cells. And by creating that protein, your body then recognizes that it's something foreign and it's something weird, and that's what your body does to create the antibodies. Is when it recognizes it, it says, we're getting rid of that, and if we ever see that again, we're gonna destroy it. So you make those antibodies to the spike protein. And the spike protein was chosen because it mutates the least, so it changes the least. So we find that these vaccines are effective against these other strains, these new variants that are out there. And you create those antibodies, and we know that they last for several months at least, and we think that they will last a whole lot longer. And people say, but this is new technology. Is this safe? This technology is actually not that new. It's about 30 years old. We've been studying this since 1990. And how did we come about it now? Well, probably the simple answer is we poured billions of government dollars to help to develop it. So it's amazing what you can do if you have an unlimited checkbook, right? So the government, through Operation Warp Speed, helped to develop this technology and to develop the delivery systems for it. There's concern that I hear, but these are so rushed. They came to market so fast. Have they been adequately tested? And what I can say is they have been. So they've been tested in 80,000 individuals before they even came to market. What I can tell you is that your blood pressure medicine that you're taking right now was not tested in nearly that number of people before it came to market. So these vaccines have been highly tested. And we did the phase 1, the phase 2, the phase 3 trials like we should, and determined that they are safe to give. What about the adverse reactions to these vaccines? Well, I can tell you, having had mine, I got in line as soon as it was available. Said, go ahead and give it to me, right? And I encouraged my parents to do the same, and my wife to do the same, and everybody that I know, and every doctor that I know has had this vaccine, and they want this vaccine, encourage others to do it. I can tell you about some of the side effects. They include headache. You might get a fever. You might feel kind of achy, not feel so great. You feel like that, you know that feeling you get when you're coming down with something, like you're coming down with a virus or something? That's what the vaccine feels like for about a day or maybe 2. And then that goes away. And that's your body's natural immune reaction. That is your body's natural mechanisms working to create those antibodies so that it learns to recognize the virus in the future. Now, how effective are these vaccines? 95% effective at preventing a symptomatic case of the virus. They are 100% effective at preventing a serious case to where you would need hospitalization. So highly, highly effective vaccines. Well, what about the adverse reactions? I saw that lady got her shot and then she passed out. Okay, that does happen. But serious reactions, like serious allergic reactions to this vaccine, occur at a rate of about 5 per 1 million shots. You got a better chance of getting hit by lightning, ladies and gentlemen. So these serious reactions are extremely, extremely rare. Now, I've been asked, but what about the long-term effects? You know, this vaccine hasn't been around that long for us to know what those long-term effects are. And I can say that that's true. However, this does work through our natural immune mechanisms, our natural immune processes in our body. What I can tell you is that we know a lot about COVID and what the progression of that and some of the long-term effects of COVID are. Now, we look at the mortality rate, which may be somewhere between 1% and 2% locally. First of all, the vaccines haven't killed anybody. So, right now we're already ahead, right? But what we find with COVID is that even if you're not hospitalized, which happens to about 20% of people that get it, even if you're not hospitalized, half of the people who have the disease have symptoms lasting for weeks or months. Symptoms like fatigue, shortness of breath, muscle aches, neurologic symptoms like numbness and tingling. And I've talked to a number of healthy people who had mild cases of the disease. They never had to go to the hospital. They were never what you would consider to be that sick. And weeks after it, they still are suffering from those symptoms. And these are healthy firefighters, paramedics. A friend of mine who's an Army Ranger who's, this guy doesn't know pain and he can't run more than a mile before he has to lie down beside the track. The most fit firefighters that I know and the most fit paramedics that I know, they say that they couldn't walk up a flight of stairs without getting short of breath. And they were never seriously ill. They never had to go to a hospital or see a doctor about it. So we know too that women who are pregnant are at an increased risk of losing the baby. We know that they also are more likely to suffer severe complications, to be hospitalized than their peers who are not pregnant. So I get that question a lot. Doc, I'm pregnant. Should I get the vaccine? And I can tell you that the vaccines were not well studied in pregnant women. We did have some patients that became pregnant during the vaccine study. We did not find that they had an increased risk of losing the fetus. But there are two large organizations, the American College of Obstetricians and Gynecologists, as well as the Society for Maternal Fetal Medicine. Now, these are the two big physician organizations that I think would have something to say about taking care of pregnant women. And both of them said that a pregnant woman should be offered the vaccine if she meets these other requirements, like having diabetes or being a healthcare worker or being at high risk. Because first, the vaccines have very limited ingredients, so there's nothing in them that we think would harm a fetus. And that's an assumption. We don't have the long-term data to show it. But because we know that women who are pregnant are more likely to suffer a severe complication from the virus and is more likely to lose their baby, they feel that the right thing to do is to protect these pregnant women through vaccination. So I know that there's a lot of more research ongoing. We've now given these two vaccines to millions of people. And we have a lot more information coming in about how these affect people. But from what we can see right now, they're extremely effective. They're very safe. They do make you feel a little crummy, okay? I'm not gonna lie about that. But I tell you what, it is worth it. It's worth it to get the vaccine and to be protected from this terrible disease. Now we have another vaccine, the Johnson & Johnson vaccine, which has just been given approval by the FDA for emergency use. Now, the Johnson & Johnson vaccine is a little bit different. They don't use mRNA in that vaccine. They use a different kind of vector. They use a virus vector to bring that same piece of genetic information to your body to say, make this spike protein. And you make that spike protein and you form antibodies to it. Now, the Johnson & Johnson vaccine is one shot instead of two, which the Pfizer and the Moderna vaccines are. And what we've found with this so far, with Moderna, or with the Johnson & Johnson, is that it is 66% effective at preventing a symptomatic case of the disease. It is 80-some-odd% effective at preventing serious complications like hospitalization or death from the disease. So it seems a little bit less effective than these other vaccines. And we ask, well, should I get the one that's more effective or should I get the one that seems less effective? I think you should get whatever one you can get. And the reason is that if you look at the flu shot is about 40 to 60% effective. So already this vaccine is more effective than the flu shot. But the advantage of it being easier to handle, because it doesn't have to be frozen, it can be refrigerated, so it can be carried to more places that can't store frozen vaccines. And the fact that it's one shot to provide that protection, to provide that level of protection, makes it very, very attractive. Because we can make up for that slightly lower effectiveness by vaccinating a lot of people. And it makes it much harder for the virus to move through our population and to get to the next person and the next person and the next person to infect them. Now, I also appreciate that our African American community has a well-earned mistrust of the medical establishment. And we don't have to look far to know why that is. If you know anything about the Tuskegee experiment or Henrietta Lacks or J. Marion Sims, that's justified how African Americans have been treated in medical research previously. And how in some medical research, African Americans are not adequately represented in that research to make sure that treatments that are developed are safe and effective as much for African Americans as they are for people who are white or people who are Hispanic, who are Asian. What I can say about these vaccines is that the Johnson & Johnson and the the Pfizer and the Moderna vaccines were tested, and they had approximately 9% of their patients were African American who received this during the studies. The Johnson & Johnson vaccine, 20% of their patients were Black who received it in the studies. So the Pfizer and the Moderna, 30-some-odd% were Hispanic. So when doing the trials, they worked hard to make sure that there was representation from a variety of racial and ethnic groups so that we know that this is both safe and effective, no matter what the color of your skin is. With that, folks ask me, would you get it? Absolutely. Every single day and twice on Sunday. And I recommend it for all of my patients. I recommend it for my loved ones as well. Because these vaccines, this is how we get out of this. This is how we get out of this pandemic, and how we can go back to taking our masks off together, to see each other smile, to go to the store without fear. This is how we get back to normal. And I look at the math, and I look at the potential for a serious reaction to a vaccine or the unknown of what could be the long-term effect, and I look at what we know about this virus. I'm telling you, doing that equation, the math favors getting a vaccine. And that's why I have chosen it, and that's why I encourage others to do so as well. With that, I'd love to turn it over to our moderators.
Thank you for that.
Much appreciated. Hi, my name's TJ Lewis, and I'm with the Family Life Ministry here at St. James. First, I want to say welcome and thank you for coming. I want to say welcome to everybody that's watching virtually. And if you have any questions, please feel free to type those into the comments section of the live stream, Facebook, or YouTube page. So we're going to do a little Q&A right now. First, I wanted to concentrate on, you talked about like allergies or reactions to the shot. If you have a nut allergy or an egg allergy, is there any side effects if you're taking the shot?
Thank you. That's an excellent question. So for the, as far as nut allergy is concerned, no, there's no concern. There's no nut products in these vaccines. With the Pfizer and the Moderna vaccine, they do not have any egg ingredients in them. So if you have an egg allergy, they're safe to take. The Johnson & Johnson, I'm afraid I don't know if there is an egg ingredient with the Johnson & Johnson vaccine.
As far as administratively, do people need insurance to have the shot, to be able to get the shot?
No, sir, these shots are provided free of charge.
If you do not have an email address, are you able to register, and if so, how?
Yes, you can register for the vaccine. What we are asking folks to do is if they have an interest in getting the vaccine, we're asking them to call 311 and leave your name and your phone number. And we have folks that are making outbound calls. The other way that we're asking folks is that if you work with a nonprofit organization, maybe you receive Meals on Wheels or something like that, just inform them that you're interested in the vaccine. And we are working very closely with them to provide vaccines to folks that they are delivering to that work with them. But that's just one of the agencies.
Well, what are the age and health restrictions for each phase of this vaccine?
The ages to receive the vaccine itself?
Age and health restrictions. Perhaps the doctor will address that. So,
anybody who has issues with their lungs, who are diabetic, they should move to the front of the list. Anybody over the age of 60, but even being younger, then they should, if they have medical conditions, should get this vaccine. Patients with sickle cell disease also should get vaccinated. As far as contraindications to the vaccine, meaning conditions that should lead you to not get vaccinated, I can't think of any. We always say, well, an allergy to the drug or the components, but because at least the mRNA vaccines are, they're very limited ingredient, there's not really a chance that you would have encountered those ingredients previously. If you've had severe reactions in the past to vaccination, then you should do it with caution and consult with your doctor about whether or not to get it. But still, because the vaccines are different from other shots that you've had before, like the flu shot, it is still recommended that you get it. And we stand by at any vaccination site to treat a severe allergic reaction that happens.
Well, that question is a great segue into asking, when you mentioned the disparities, if a person has diabetes or another health chronic condition, that they should move to the front of the line. So are there any side effects if you take other medications, if you are diabetic or have hypertension, high blood pressure?
That's an excellent question. And not specifically with these vaccines, no. You can continue your normal medication, and I strongly encourage you to do so as you take the vaccine. The one caveat is we do recommend that when you get vaccinated against COVID-19, that you don't have any other vaccines 2 weeks before or 2 weeks after you get that shot. So for a lot of our patients who are, they're up in years, and these are folks, especially over the age of 60, we want to make sure that they're vaccinated and protected. But they may also be it might be about time for the shingles vaccine or the pneumonia vaccine. Right now, we don't give the COVID vaccine with another vaccine. So if you've had your shingles shot, wait 2 weeks until you get your COVID vaccine and vice versa.
Well, just as the flu has become an annual requirement or recommendation, will COVID vaccine become an annual process?
Will COVID vaccine become an annual process? I sure hope not. And the reason that the flu has become an annual thing is because it mutates so fast from year to year to year that we need to update that shot. We are seeing new variants of COVID. The more it spreads, the more it mutates, and the more likely that is that this will then become a regular thing that we're seeing every year. If we can get our vaccination efforts done, if we can get most people in the United States vaccinated against it, then we can bring the pandemic to a halt and then not have it spread anymore. That's my sincere hope. And I hope that we get this vaccination effort done before we start seeing too many mutations.
Well, is there a national registration database to log and view side effects?
Excellent question. So after you get your vaccine, then you log into a system from the CDC called vSafe. And when you get your vaccine, you should get a card that tells you that website. And this is an app that checks in with you once a day after you get your shot, and then after a week period, then it's once or twice a week. And it checks in with you and says, how are you feeling today? Like, are you having any side effects? We now have millions of people who have registered within that system and are pouring that information into the CDC. So they have a much better picture of what the side effect profile looks like, if people test positive for COVID after being vaccinated, and if anybody's hospitalized. So this is going to be a great source of information for us going forward, knowing the vaccines, what the reactions are, and even better, knowing how safe they are.
So a question about the Pfizer and the Moderna. So you brought up that there are 2 shots for each of them. Is it okay to mix one with the other?
Excellent question. If you're vaccinated with one, you should not be vaccinated with the other for your second shot. So whichever one you started with is the one that you should stick with there. Now, the Johnson & Johnson, of course, that's one shot and done. They are doing studies on it now with a second shot of the Johnson & Johnson. We hope to have that information. Johnson & Johnson studied only the one shot because they know how hard it is to get the vaccines out to folks and to follow up and how troublesome that can be. And we're hoping that that data shows that the J&J vaccine is even more effective if you get a second shot. But whichever one you got, stick with that one.
So with the new variants that are coming out, is one shot better than the other to handle those variants, or is it, like you're saying, just best to get whatever shot's available at that time?
So far, these shots seem to be very effective against the variants. There is a South African variant that has come out, and the shots are a little less effective against that one. Now, the Johnson & Johnson vaccine, having been tested in South Africa and the United States, that was shown to be effective against that variant, but a little bit less so. The Pfizer and the Moderna may be a little bit less effective against the variants, but still very high levels of effectiveness against the new variants that have come out.
And then, does the vaccine, does it cause infertility?
Excellent question. So I've read this rumor online too about vaccine causing infertility, and the answer is that is not the case. This was a rumor that started, and the folks who started the rumor were saying that the spike protein is similar to a protein in the uterus and the placenta, and that then it would cause you to attack the uterus or the placenta, and then same thing in the testicles, that it would make you infertile. That is not true. We've seen no evidence of that.
Does the virus cause cerebral palsy?
Does the virus cause cerebral palsy, or the vaccine cause cerebral palsy? No, not that we know of so far. Those studies are ongoing because now, of course, we have millions of people being vaccinated, and some of them are or are going to get pregnant, and we'll know more about that. But so far, we have not seen any evidence that the vaccine would cause cerebral palsy.
Are there booster shots being created for the new COVID-19 variants?
So far, we are not aware of any booster shots or modified vaccines for the variants just yet.
Okay. So with that, we want to keep this as a facts and dispel all the fictions. So we want to kick it over to our group, Kim Walker, and she's going to bring some questions from YouTube, Facebook, and live stream.
Hello. So, take my mask off. Great information, by the way, and the questions are just like flowing in. So let me get started here. One question is, well, that's not necessarily a question. What is the underlying condition? And I think you kind of mentioned, but could you go over the underlying conditions again?
Yes, I'd be happy to. So advanced age above 60, diabetes, lung disease, so COPD, emphysema, chronic bronchitis, really any lung issues, sickle cell anemia as well. And if you have those conditions, even at a younger age than 60, you should be vaccinated.
Thank you. The next question, we have been in category 1B for a while now. When will the vaccine be open to everyone?
As soon as we possibly can. And I appreciate that we've been in 1B. We've got about 500,000 people in our community that are in the 1B category. And although we're vaccinating as fast as we possibly can, we still have a ways to go on those folks who are 1B. And as you saw, also the governor has asked us to prioritize teachers and school workers. Because they're in groups, and also a lot of our teachers and school workers here in the Austin community are above the age of 50 and do have chronic medical conditions. Many of them already fall into that 1B category there. So as soon as humanly possible is the answer. When that's going to be depends on the vaccine supply. We've been giving a lot of shots, and we will give as many as we get. And if you could wave a magic wand and give us 1 million vaccines tomorrow, then we'll find a way to give the 1 million vaccines next week. I'm sorry, I think poor Stephanie her blood pressure just spiked when I said that. But yeah, we'll do it. Right now, those efforts are solely limited by the supply. This is why I have a lot of hope with the new Johnson & Johnson vaccine. Also, that gives us even more, and we know that Pfizer and Moderna are ramping up their production as well, and that we'll see more and more vaccine being given in this area. We're already giving tens of thousands per week, and we absolutely want to do way more.
Awesome.
One thing I will add that is going to help us with kind of working our way through the 1B is the federal government has approved a pharmacy program. And so most of you may be aware, but now HEB has vaccines this week. CVS, Walgreens, Walmart, Sam's, all of them have a federal contract and will be receiving direct shipments of vaccine. In the Austin and Travis County area, there are 350 locations that are approved to provide vaccines. And so once the supply increases, all of them are ready. Had a conversation today with a dialysis company, and they have been approved to provide vaccines to their dialysis patients. And they're just waiting to get the vaccine. And so once it is widely available, we're really excited about the increased production.
Good information. I'm going to just recognize this is it piggybacks on what you just said, but One of the questions was, can you get the vaccine from your primary doctor in office visit?
You can if you're, so the Texas Department of State Health Services, they approve the providers. And so if a provider, which is your primary care physician, has gone through them and received that approval, they can provide you that vaccine in their office. Typically, it is providers that may provide other vaccines. So if you've received a flu vaccine from your physician, most likely they would be administering this as well.
Okay. The next one is, what can be done to expedite registration for the shots? When can people expect notifications that information has been received and a date they are scheduled for the shot?
So what we were doing last week because of the storm is that we really needed to increase our number of vaccines that we provided. So from Sunday of last week up until yesterday, we provided 33,000 vaccines. And so this week, we relatively got caught up, and so we started to release more appointments every day. So we released appointments on Monday, Tuesday, and this evening. And so typically, that will let you kind of know what time you can schedule for your appointment, et cetera. Now, what we always do is that we tie the appointment to the vaccine itself. So we will not schedule you for an appointment if we don't have the vaccine.
Okay. The next question is, what if I really want the Johnson & Johnson vaccine? Could I request it?
Yes. In my conversation, for example, with HEB, what we talked about is that they would have all three of the vaccines. I will tell you that because of the production, like for example with public health right now, we only have Moderna. We have said we would like to receive Johnson & Johnson. We would not sign up to receive Pfizer because we do not have that refrigerated equipment, extra cold storage. So it's easier for us to handle and manage Moderna and Johnson & Johnson. So those are the two that we would be offering folks in the future.
Thank you. What if you get allergy shots? Do we wait to get the vaccine?
That's an excellent question, and I would leave it to your allergist to make that determination as to whether or not you should get both at the same time. I didn't see that in the initial studies. Of course, we now know that. That's a little bit outside of my specialty, so I don't want to hazard a guess and tell you wrong. I would say talk with your allergist and see what they say. If they want to put your allergy shots on hold for a minute while you get the COVID vaccine, I think that would probably be reasonable to do.
And I think this is a follow-up that Ms. Duncan Hurdle had. At what age should children be vaccinated?
That's an excellent question. We don't know that yet. The vaccines had not yet been studied in children, although my understanding is that those studies are ongoing. And the focus has been on adults because we know that there is, as you get older, an increasing likelihood of a serious complication of ending up hospitalized or in the ICU or dying of it. But we also know that children can suffer severe complications from this as well. That they can get inflammation of several organs, what we call the multi-organ or multi-system inflammatory syndrome for children. That they can get inflammation of their heart. So for example, the high school athletes that catch COVID, if they have any evidence of heart dysfunction, of shortness of breath, of any issues with their echo, the cardiologists recommend that they don't have any play for a year. So it's a big impact even for our younger patients that are not so likely to be hospitalized. So as of right now, we don't know when that, like what age that would be best, and we're still studying the efficacy of those vaccines in children. Hopefully we'll have an answer on that sometime in the near future.
Are HIV positive individuals protected due to taking retroviral medications?
Excellent question, and the answer is no. They did study these antiretroviral medications, these HIV medications, in preventing or treating COVID-19. They did not find that they were effective at doing so. So unfortunately, those medicines do not protect you.
What about high blood pressure? Is this considered to be an underlying condition?
High blood pressure is an underlying condition, yes. So folks with high blood pressure do recommend that they get vaccinated.
Following the same line, would obesity be considered as an underlying condition?
Obesity is as well, because we know folks with obesity are much more likely to have serious complications.
The next one, I have low blood sugar, hypoglycemic. Will I have any more complications with the vaccine?
With hypoglycemia, I don't believe that you would have any more complications with it. Now, with that caveat, that when your body kicks up its immune response and you get a fever or something like that, it does take energy. And if your blood sugar tends to run low, you probably have seen this when you get sick, that your blood sugar tends to run low, you have to eat more. Well, the same thing may be with if you have a brisk immune reaction, fever, that kind of thing from the vaccine, that you know where they said, like, feed a cold, starve a fever? None of that's true. Feed everything, okay? When you went to your grandmother's house and she said, you look sick, sit down, you got to eat something, then she was right. But as far as a serious complication, I do not expect that you would find a serious complication just due to the hypoglycemia.
Okay. Is there a fee at CVS or Walgreens for the vaccine?
No, it shouldn't be a fee anywhere you go because the vaccines are being provided by the federal government. Now, one thing that several providers may do is they may ask you for a copy of your insurance card. Because it's like when you go to CVS and get the flu vaccine, and if you have insurance, it's a covered vaccine, and so they may be able to recoup some administrative costs by reaching out to your insurance. But there is no cost. You should not be turned away because someone is trying to charge you for paying for the vaccine.
Thank you. I'm going to go back to the obesity question. Someone asked, could you please define what is classified as obesity?
A BMI of greater than 35 is that's somebody who's considered seriously obese, and I would definitely want them to get protected.
Thank you. How many times can an individual contract COVID with or without the vaccination?
Well, unfortunately, we don't know exactly that. We know it's at least twice because we've demonstrated many people who have caught COVID more than once, who've done at least twice. And when we looked at the genetic information on the virus they caught the first time and then the second time, we know that they actually caught it again. Is there a limit to that? I don't know.
Okay. And so I saw an article about lymph nodes and possible swelling and showing up in mammograms. Is this being considered or discussed?
It is, and that would be a normal reaction after a vaccination, after any vaccination, because your lymph nodes, they swell when your body thinks it's fighting an infection. So they kick into high gear and they will swell. You'll notice this after a flu shot. You'll notice this when you just catch a virus in general. And so that is not uncommon with vaccination against COVID as well. However, if you get the shot and then you go in and very shortly thereafter, and your doctor says, "Oh, you have swollen lymph nodes," is this a concern for a sign for breast cancer? Well, that we see swollen lymph nodes all the time, and what I, as your doctor, would say, you just got a vaccine? Tell you what, come back in a week, let me check you and check again, see if we still have the swollen lymph nodes and see if they've gone away.
Okay. It says, I am 66 years old and Hispanic. I have tried many times to get an appointment for the vaccine before the freeze. So what do you recommend? How can I get an appointment?
What we would recommend for that person is we just would ask them to go ahead and call 311, leave a message. We have established an equity outbound, which they make outbound calls. So they would give him a call back. Typically, it's 2 business days when he calls 311 that our team would be able to call them back and schedule an appointment.
Thank you. Once vaccinated, if you become symptomatic, does that mean you have COVID and can spread it to those with whom you come in contact with?
Excellent question, and that kind of dovetails on this question, which is, I'm fully vaccinated, why am I still wearing this stupid mask? And the reason is that we think it may be possible, but we're not sure yet, that you could contract the virus without symptoms after you've been vaccinated and still potentially spread it to others. And that's why we recommend, even if you've been vaccinated, that you still wear a mask when you're in public and around others, especially people who are vulnerable. Now, you can potentially contract COVID still if you've been vaccinated. Folks who have received any vaccine may not get a full immune response. And as we see, there's always a percentage of people who, even though vaccinated, can catch the virus again. So if you have symptoms consistent with COVID, cough, fever, shortness of breath, things of that nature, we do recommend that you go ahead and get tested for it. Now, a related question that comes up is, if I've been vaccinated against COVID, am I going to test positive just because I've been vaccinated? And the answer is no, if it's like one of the typical nasal swab tests or oral swab tests that you get. Now, you may have a positive antibody test, which that's a drop of blood that goes on a card or drawn into a tube, and that shows that you have antibodies, and that's actually the response that we want from vaccination. So that might be positive. But as far as like if you get sick and you go get swabbed and it comes up positive, that's not because of the vaccine. That's because of the virus itself.
Okay. I think I have 2 more. One is, I have a relative that had confirmed COVID case last year. Should she receive a vaccine, or will her natural immunity now be enough?
That is an excellent question, and we do recommend that people who've had COVID-19 before do get vaccinated. We have proven that people can catch it again, and your immunity lasts for a period of time. Exactly how long that is varies from person to person. We know it's about 3 months at least, and in some people we believe it to be substantially longer. But for some people, it's only 3 months. So we do recommend, especially if you're at risk, that you do get vaccinated against it, even if you've had it before.
Okay, so another one popped in. Is it okay to take pain medication before the vaccine?
Is it okay to take pain medication before the vaccine? It depends on what you take for pain medication. You know, if it's 2 or 3, a Johnny Walker, or my favorite, a little El Yimador, something like that, then a limited amount. Yes, that's fine. But what about like Tylenol or Advil or anything like that? Yes, it is safe to take pain medication for the side effects of the vaccine, because your arm may be sore, your body may be sore, you get fever, headache, those kinds of things. The concern that people have is those things like ibuprofen or naproxen, those are anti-inflammatory medications. Could they make the vaccine less effective for me? And the answer is, we don't think so, no. It's a very common practice to take some ibuprofen around vaccination, and that so far does not really seem to significantly impact the effectiveness of the vaccines.
Okay, I'm sorry, questions are still coming. um, if you catch the virus, no. If you catch the virus again, will it be as bad as the first case?
Most of the time when people catch the virus a second time, it is milder than the first time that they caught it, most of the time. But that said, if you've been through it once, you probably don't want to be through it again. But that's what we know about the reinfections so far. Now, there are a lot of reinfections that happen that we don't know about because we're not doing as fierce a job of testing the genes that when people get infected again. So there may be a lot of cases that we are missing when that happens.
Okay. If you're asthmatic and have sleep apnea, is that a priority to be in, I guess, in 1B category? Yes.
Yes, lung disease. Yeah, so
Yes.
absolutely.
Okay. Another question is, can the church be one of the hub sites for the vaccine?
So in order to be a hub site, you have to be approved by the state of Texas to be a hub site. The definition of a hub site is you have the ability to store the vaccine safely and securely. You have the ability to provide thousands of vaccines in a short period of time. Now, what the church can do, which would be easier, is to partner with like Austin Public Health, UT Dale Med Health, or some other provider that has the ownership of the vaccine and will assign a vaccine manager. It's like in the past where we've, have gone to places and provide flu clinics. You want to do something that's similar to that.
Okay. Did they have any patients in the studies with sarcoidosis?
I don't know specifically if they had patients in those studies with sarcoidosis, but because of the effect on the lungs of sarcoidosis, I would strongly encourage vaccine of anyone who has that.
They ask, is there an estimated date, for Walmart and Sam's to have the vaccine?
We know that Sam's and Walmart is in the Houston area. They established about a week or so ago, well before about February 12th or so. What I am hearing from the regional manager in my conversations with them is looking like they would be sometime in late March or early April in Austin, in this kind of vicinity, Travis County, Williamson County area.
Okay. And I think I've asked all the questions from Facebook here, and I'm gonna let her.
Okay, question is, now that the governor has lifted the mandate for masks, how and where can everyone be vaccinated quickly?
So now that the governor has lifted the mandate of the mask mandate, it is even more important for us to get people vaccinated as quickly as we possibly can. And again, that is limited by our supply that we have. As I said before, we're not ready to take our masks off in this area. We've got too much. There's too much spread, and right now our hospitals are still needing a lot of help in taking care of the number of patients that they have, and that's why we have this alternate care site in the convention center. But yes, the mask mandate, I strongly encourage everybody, keep wearing your masks, keep doing what we've been asking you to do, because it's so important. And we do have evidence, we have good medical literature showing that these even the cloth masks do help to slow the spread of the virus. They do help to protect not only you, but the people around you.
Okay. What would your most simple message be to those who are weary about the vaccination, being vaccinated?
I would say that it's so important because when you think about how can I normalize things, I tell people we're at a place where it's a new normal for us, but we do want to be able to normalize things. We also want to be at a place where we can reduce the number of people that are suffering from severe disease and death and hospitalizations. And so, for me, I've always saw this work that I do and had the passion because I love health and love working with people as a social worker. But what turned for me in November is one of my really good friends died of COVID complications. She had moved back up to Lubbock to be closer to her family, really sick with COVID. And so after that just really pushed me even more to say, I've got to make sure that when this vaccine comes out, I can do everything in my power to get it to the people that need it the most.
Dr. Pickett said 3 months for immunity. Is this just for natural immunity or for a vaccine-created immunity?
So after infection, we believe that you have immunity from the virus for about 3 months, and then it may taper off after that. After vaccination, after your first shot, you're already at 85% immune, just a couple of weeks after that. About 2 weeks after your first shot, you already have built up good immunity. And then by 2 weeks after your second shot, then you're good. You're 95%. And how long that immunity lasts, we don't know yet, obviously, because the vaccines haven't been around that long. But the studies that we have done show that the vaccine creates more antibodies, creates a more robust response than the infection itself does. I'd also you had that such an excellent question too. What's a simple message that you want to get out about vaccines? This virus is here. You have a choice. You're going to get the virus unless you have the vaccine. It is only a matter of time before you run into this virus. And I look at the math on both of those. I look at all the complications of one and the other. And the clear choice is I would much rather take my chances with a vaccine.
Okay, thank you. You said before, but someone wants to, can you repeat where are the 3 locations?
To receive the vaccine right now that Austin Public Health is, we are providing vaccines at Delco, the Performing Arts Center, and the Dove Springs Recreation Center. We're also in Pflugerville at their recreation center, so we actually have 4 sites.
Thank you.
So this is actually going to conclude the questions, but this wasn't a question, but they asked would you like to run for governor?
That's very kind, but I don't want that job. That's a tougher job than the one that I have right now. That's true.
With that, we want to thank you, Dr. Pickett, Director Hayden Howard. It was so much wonderful information that was fact-based, and it's great just to get it out to our community, and we want to just say thank you. With that, we want to bring Reverend Sweeney to close us out.
Thank you.
Amen. We do say, again, thank you to everyone, the panelists, and for such great information that has been disseminated tonight to all of us here and also via live stream Facebook. We want to also acknowledge we have three pastors here tonight, and Pastor Darrell Harden from the Mount Zion Missionary Baptist Church, Pastor Ray Hendricks from the Rehoboth Baptist Church, and also from Wesley, Pastor Chase. So thank you all for coming in, and that's why we're here, to try to better equip our congregations with information to educate them on more information about what we're dealing with, our challenges that we face in this 21st century. To our communications department, Kim, Cassandra, Lisa, Anthony in Austin, to Brother Crenshaw, our camera person, and to all of you that are our guests that are here tonight, thank you for coming. And just, our panelists have done an excellent job tonight. I tell you, I've learned more tonight. There's always more to be learned. Amen. Never think you get to the point where you know it all. There's always more to be learned, and we can further educate our families, our co-workers. We can share tonight what we learned with them. And thank those for calling in with the questions tonight. There were some excellent questions that were called in by those from the outside on our live stream media. So thank you so much for everyone for what's been done tonight. And we thank you and we bless you, and may God keep you. And if there's nothing more, let us give our benediction. Eternal God, our Father, we come tonight. We're just so grateful and thankful for this opportunity that we've been here, and we've heard great information that can help educate us to share with each other and pass it on to our families, our co-workers, to our neighbors, and the people we run into at stores. It's just thank you for this information tonight. It's going to help us to stay safe and help us to do what needs to be done to stay alive. We love you. We thank you. We, again, bless everyone that's here tonight. Keep us all in your care. In Jesus' name we ask it all and do give thanks. Amen. You're dismissed.